Coronary artery disease is, people consider that as blockage. It's when people develop cholesterol plaques inside the arteries to their heart, and that's when people can have a heart attack or have angina, which is basically chest pain. The most common age group is between 40 and say 80. As people get older, they develop more problems with their heart, with like blockages, and they'll develop these plaques inside their heart. And when they have other risk factors for coronary artery disease like diabetes or high blood pressure, or if they smoke, if they have high cholesterol, or say somebody in their family has heart disease, they are also at higher risk for having coronary artery disease. The Heart Association recommends 150 minutes of exercise per week, which really comes out to be 30 minutes 5 days a week or something like that. Obviously, we don't want you to smoke. That's a really bad risk factor for developing coronary artery disease and plus cancer. So that's an important. Your blood sugar and your blood pressure are also very important numbers to make sure that those are in good order, because again, these risk factors, blood sugar, blood pressure, cholesterol, those sorts of things are the ones that you can change. You know, your family, if you have a family history of heart disease, that's also a risk factor, but you really can't change who you're related to. When people are doing regular routine activities that are exertional and they start developing chest pain or maybe some shortness of breath, oftentimes people will develop chest pain, and it may go down into their arm or up into their jaw or over to their back. Those are symptoms that are worrisome for the possibility of coronary artery disease, although sometimes that can happen when you have high blood pressure too. The typical definition of angina is chest pain that's brought on by exertion or mental stress that's relieved by rest or nitroglycerin. And when people have angina, that is a symptom of worsening blockage or coronary artery disease. When somebody starts having these sort of symptoms of chest pain or maybe shortness of breath, then the first thing they ought to do is go see their doctor. And their doctor may refer them on to a cardiologist, or if they're really having severe symptoms, may even refer them on to an emergency room. And oftentimes we'll do testing, say a stress test or maybe some blood work, or even if it's really bad, we do something called a heart catheterization. But those are the sort of things that your doctor will be the decision maker for, or to help you sort out your symptoms.